Get rid of stubborn cellulite.
I just have not been able to find anything that works.
35-year-old Brianne Edwards says she exercises daily and eats right, but has always struggled with cellulite.
When you're always thinking about it, it kills your confidence.
Brianne heard about a new treatment called Cellulite, an FDA-cleared outpatient procedure promising to improve the appearance of cellulite for at least 1 year.
Hi, Brianna.
Board-certified plastic surgeon Dr. Grant Stevens says his patients are loving the results.
People are skeptical. I don't blame them. So was I.
But you've seen the real results.
I've seen the results.
Just look at the surprising before and after photos.
It's safe, it's easy, and it really works.
Cellulite uses a very small blade to cut through the connective bands, pulling down the skin, creating a dimpled appearance. Once the fibers are released, Dr. Stevens says the skin bounces back and becomes smooth. Though critics warn before spending $3,000 to $6,000 for the procedure not to expect perfection.
For a lot of people who have diffuse cellulite, say all over their butt and their thighs, it's not going to fix everything.
Brianne is prepped and given local anesthetic.
You feel a little prick right there, boop, that's it.
Dr. Stevens releases the fibers using a small blade.
So I can see the dimples actually releasing.
Brianne even sneaking in a selfie.
Hey, there we are. All right.
After just 45 minutes, the procedure is over. Dr. Stevens says Brianne might have some swelling and bruising, but says she'll be bikini ready in just 2 weeks. For Good Morning America, Abby Boudreau, ABC News, Los Angeles.
All right, so joining me now is Dr. Jennifer Ashton, and that technique does look amazing, but let's just go back and talk about what causes cellulite in the first place.
So let's go through some anatomy first, Lara. If you look at normal skin under the surface, what I want you to look at, there are these dense, fibrous bands of tissue. They separate these subcutaneous fat compartments here, and then you have the dermis and the epidermis, and you can see in this case it's smooth. Now when you look at cellulite, what you're going to see there is a tightening of those bands. That's what causes some of the dimpling. You have an expansion of this subcutaneous fat pockets, which bulges out, and you have a laxity or loosening in the dermis, causing the cottage cheese surface that we see in the epidermis.
So it's sort of a perfect storm of things that have to happen to cause it.
Absolutely.
Okay, so let's talk about some of the common myths. Factor myth, okay?
Yes.
So first of all, over-the-counter remedies. Do they work for cellulite? I know many of us have bought in.
Don't shoot the messenger, but the official answer is really, it's fiction. And I'll tell you why. In terms of a cure, they largely don't work. And if you look over here at this mattress, again, it's a cross-section.
Which is brilliant, the greatest prop ever.
Thank you. Thank you. My producer and I thought this up. If you look at what the superficial creams do, they're only hitting the surface here. So the epidermis is just where you see the puckering. They really barely penetrate the dermis, and they definitely don't hit these fibrous bands and these compartments of fat. The caveat is that caffeine creams can stimulate fat breakdown, and if you use a cream with retinol, it can thicken this layer of the dermis a little, but will it cure? No.
Okay, but so retinol and caffeine,
they're good.
Maybe a little bit more of an effect. Okay, also, a lot of people talk about exercise. Does exercise have an effect on cellulite?
Okay, I'm going to say this one is a fact. You'll never hear me say exercise is bad for you, but is it going to cure it? Not really. The way exercise will work, it'll shrink this fat compartment a little bit, and it will build muscle, which is found down here. And again, will that smooth out the surface a little bit? And remember, men get this too.
Yeah.
So it's not just us ladies.
And just be healthy. And
Healthy
as Demi
is
Lovato
always
just
important.
said, love the skin you're in.
Absolutely.